This is Dr. Dave Seftel reporting from AAO 2015, and we're here with Malini Veerappan from Duke University. Welcome.
Thank you.
So tell us a little bit about your background and how you came to do this particular line of research.
Sure. So I'm currently a third-year medical student at Duke, and I'm doing research with Dr. Cynthia Toth on AMD, or age-related macular degeneration. I became particularly interested in ophthalmology as a line of research and as a subspecialty I'd like to pursue in the future with an internship that I did over the summer in India. I entered at an eye hospital in Chennai called Sankara Nethralaya Eye Hospital, and I became particularly inspired by the idea of preventable blindness. Many patients that I saw coming to the hospital were needlessly blind or visually impaired due to preventable causes of visual impairment, more specifically due to economic and social barriers. And I became particularly interested in addressing these barriers and learning more about them.
What kind of infectious diseases and environmental insults predominated in the developing world?
So the predominant demographic of disease that we saw there were cataracts. Many of the patients present to the hospital with complete visual loss, and we were able to, or the physicians there were able to restore their eyesight within, with a 10-minute surgery. We also saw some infectious diseases such as trachoma, as well as endophthalmitis in the visiting patients as well.
Turning to your research presented here at AAO 2015, tell us about the focus and your conclusions.
So the focus of my research is age-related macular degeneration, or AMD. And as we know, AMD is a leading cause of blindness in the Western world, with over 10 million Americans affected. And currently we're lacking effective treatments for advanced stages of AMD, except for in certain late manifestations. And intermediate AMD, specifically early and intermediate stages, are characterized by Drusen, or accumulation of deposits between the RPE and the choroid. And advanced stages of AMD are characterized by central geographic atrophy and choroidal neovascularization. And our group has been particularly interested in finding structural biomarkers that may predict progression to advanced stages of AMD that are associated with vision loss. And to this end, my project has focused on a substructure within Drusen, which we have termed OCT reflective Drusen substructures, or ODS. These substructures we've categorized into 4 subtypes: low reflective cores, which are characterized by hyporeflective circles within the Drusen; high reflective cores, which are characterized by hyperreflective circles within Drusen; conical debris, which is characterized by a conical shaped Drusen with multiple hyperreflective foci within; and lastly, split Drusen, which is characterized by an entire Drusen that is split in some proportion between high and low reflectivity. And my goal in my research was to identify and characterize these ODS and examine their relationship with AMD disease status and disease progression.
What are you measuring reflectivity against? What are the compounds that are reflecting back?
So the compounds that are reflecting back are mainly protein and lipid deposits within the Drusen.
Tell us about how you're trying to quantify what these proteins are, what are the composition of the Drusen that is reflecting.
So we have, for the study, we've drawn our participants from the larger nationwide prospective study called Age-Related Eye Disease Study 2, or AREDS 2. And these are patients with AMD who have annual and biannual visits, during which they receive SDOCT imaging, color fundus photography, and other clinical examinations. We are able to collect this data about the ODS, or OCT reflective Drusen substructures, through examination of the SDOCT volumes that have been collected from these patients at each annual visit. And so in our lab, myself and other graders go through these SDOCT volumes to identify and characterize any ODS that we may find on the volumes that we're examining.
In terms of the chemistry of these deposits, how are you working to establish what that is?
Good question. So this study is an in vivo study. We are studying images from patients who have AMD and are visiting clinics on a regular basis. Now that we have found these OCT reflective drusen substructures, we're curious to know what they consist of. And so we're now pursuing postmortem studies in which we are looking at eye bank and autopsy eyes to OCT image the eyes and subsequently slice them to see what these OCT substructures actually consist of on a histopathological level.
What have you found so far?
Currently, the OCT probe is in developing stages, so we have not done a formal examination of these substructures.
So what are your next steps with this particular line of very promising research?
So currently, with the current research, we found that these OCT reflective drusen substructures are strongly associated at a macular and a regional level with progression to atrophy. And so in the future, we're hoping to pursue a couple of follow-up studies. One is to continue to longitudinally examine these OCT reflective drusen substructures at later years, and also to study the precursors to these OCT reflective drusen substructures. So to look backwards from the time of identification to see if we have SDOCT features that are predictive of development of the ODS that have proven to be so important.
So tell us about your pathway forward in terms of a career. Is this a particular line of research that you're going to pursue over time, or do you have other interests within ophthalmology?
Absolutely. I have become very interested in retinal research, especially with such an amazing mentor like Dr. Toth. She's really been very inspirational for me, and I am very open to pursuing retina as a future subspecialty within ophthalmology, and open to exploring other specialties as well.
Tell us about the potential translational implications of your work.
Sure. So through this research, we have demonstrated that ODS may be a very important biomarker to predict progression of AMD. And the clinical implication of this is that we think that identifying this feature on SDOCT may be a very important tool for tailoring management options for patients with this SDOCT feature and potentially having a prognostic feature as well.
So do you see this becoming potentially a protocol that all ophthalmologists who see these patients will follow?
I think that identifying patients with ODS can guide management options, can guide therapeutic targets, and can alert us of patients who are at risk for vision loss.
Malini, thank you so much for joining us. We'll be watching your career and following you very closely.
Thank you so much.
Thank you, and take care.
You too.
Very good.